This is part 4 of a 4-part series where we talk about the signs and symptoms of the most common hormonal conditions and what you can do about it. So today we are talking about elevated androgens. Now, when I think about elevated androgens in women, because that's typically who most of my audience is, there are really 2 big causes. One is congenital adrenal hyperplasia, which is very uncommon, and the next is polycystic ovarian syndrome, which is very common. Now, 1 in 5 women who are of childbearing age in the United States is diagnosed with or has PCOS and doesn't know it. Now, when it comes to PCOS and these elevated androgens, this is one of 3 different factors that are needed to diagnose PCOS. So in order to be able to be diagnosed with PCOS, you have to have 3 different criteria that you meet. You have to meet 2 out of these 3 criteria. So 1 is the elevated androgens in your blood. So you're testing for those androgens in blood work. The next one is missing or irregular periods. And then the third one is you do an ultrasound of your ovaries and you see that there are cysts on the ovaries. Now, when you think of the name PCOS, you might think, oh, I have to have cysts on my ovaries in order to be able to be diagnosed with this condition. And the reality is actually, no, you don't. You don't have to have the cysts. You just have to have, like I said, 2 of those 3 criteria. So maybe you have the irregular periods and the excess androgens and you don't have the cysts. You still meet the criteria to be diagnosed with the condition. So the reason we're talking about this, like I said, is because this is really the most common hormonal imbalance that we see in the women's hormone world besides hypothyroidism and HPA axis dysfunction. This meets the top 3. So when we think about the elevated androgens that are coming along with PCOS, besides the fact that PCOS also causes estrogen dominance because of the missing irregular periods, the elevated androgens is really what's causing all of the symptoms within this condition, right? And so what are the symptoms of elevated androgens? How do you know if you should be tested for this within your blood work? One is you have hirsutism, which is growing facial hair when you should not be growing facial hair as a woman. So this is typically if you see like you have the dark little hairs coming onto your chin or above your upper lip. This is a sign that there is too much testosterone or potentially too much DHEA going on, and we want to get a better understanding of what those hormone levels look like for you. The next one is you don't have hair where you want to have it, and so the hair on your head is actually falling out. This can be often mistaken for something like hypothyroidism, but it's again often a sign that something is going on with your androgen levels. The third thing that we want to be looking out for is acne. When you have acne, whether it's all over your back, on your shoulders, on your face, acne is a really, really big sign that androgen levels are potentially off in females. The next thing that you want to look out for is weight gain. Oftentimes, because PCOS is an insulin resistant disorder, it is a metabolic disorder along with a hormonal disorder, there are a lot of instances of weight gain that happens. Because of the elevated levels of androgens, women often take on that apple shape within their bodies. So more fat storage around the midsection. I'm touching my pregnant belly right now as I say that. The next thing is irregular menstrual cycles. So the elevated levels of androgens would be the cause for the irregular menstrual cycles, and the effect of that would be the estrogen dominance because there's not progesterone that is released in the second half of the cycle. And so you would have the elevated androgens that are causing the missed ovulation, the skipped periods, the irregular cycles, and then you have the other symptoms of estrogen dominance that come along with it, whether that's water retention, some anxiety, some trouble sleeping, things like that. And so unfortunately, you have both of these things happening, but the root cause underneath both of them is dysregulated blood sugar and insulin levels. And so when we think about doing the proper testing to look at your androgen levels to check into PCOS, we want to look at a few different things. Obviously, the first one is you want to look at your DHEA levels. You can do that through a blood or a saliva test. You can do that through two different ways. You want to look at your FSH and LH levels. Those are the signals from your brain to your ovaries telling you when to develop an egg, when to ovulate the egg, and when the ratio of those hormones are off. That's a signal and a sign of PCOS. You want to look at your blood sugar and your blood sugar and insulin levels, because while these are not technically looking at your androgens, they are looking at the root cause of PCOS for most people. Now, PCOS can also be caused by inflammation. It can be caused by pill-induced PCOS, but for most people, it is an disorder of insulin resistance. It is a metabolic issue just as much as it is a hormonal issue. So you want to be looking at, what is my fasting blood sugar? What's my A1C? What are my insulin levels? So doing the right testing can tell you so much about what's going on with your body and how to solve it. Because oftentimes in my practice, in so many other holistic practices, I have seen the not necessarily reversal, but symptom suppression of PCOS with a good exercise routine, a nice balanced, high protein, high fiber diet, and lower levels of stress and inflammation, cutting out toxic chemicals and products. And so if this is you, if you relate to these symptoms, the acne, the hair loss on your head, the hair growth on your chin or on your face, and you are feeling the weight gain, the irregular periods, go get your androgen levels checked, go get your blood sugar and insulin levels checked, and try to get a diagnosis of PCOS from your doctor or your holistic practitioner. I hope that this video was helpful and that you have more tools in your toolbox and more things on your list to be able to ask the right appropriate questions to your doctor or your healthcare provider. You can subscribe to our channel, like, rate, and review this video, and I will see you next week.